Hi everybody, it's Kim Bergen-Jackson, administrator at Oakal, and I am taping on Wednesday, April 3rd for your viewing pleasure on Thursday, April 4th. I'd like to say it's spring, but as you all know, it's been snowing for 2 days, so it's very irritating and bizarre weather we're having, but at least it's not sticking on the road, so I guess I'm grateful about that. It's going to be really windy today, and then hopefully it'll warm up and we won't have to worry about it anymore. But snow in April, it must be something crazy is going on. My COVID update is really brief because there isn't any COVID. How about that? Is my third week in a row maybe saying that? No COVID cases in the staff, none in the residents. And I have a date for the COVID vaccine clinic. So you should have gotten a note in your mailboxes. It's April 17th. Maine Healthcare Pharmacy is providing the clinic for us. However, they would like to have the forms filled out and completed by Friday, this Friday, the 5th of April, because they're going to do pre-billing to make sure that it's all covered by insurance. Because if you remember, the government was paying for the vaccines for the longest time, but now they've commercialized the vaccines, and so they will bill your insurance. They promised me that you should not have a copay, but if you do, just let us know. We'll call the pharmacy and get it worked out. So that's April 17th. They're going to do the health center and assisted living first. We don't take everybody over to the hiding room for that. They'll go through assisted living in the health center. When they're done here in the health center, they'll go over to the hiding room, and we're going to be in B, so that we don't get in anybody else's way who has already reserved A. And then they're going to go to East. So that's amazing that they're willing to go to 4 different places for us to do the vaccines. So if you have not had, and this is what it is, it would be the second vaccination of the 2023-2024 updated vaccine. So they've made it a 2-shot series for people who are over the age of 65 or people who are immunocompromised. So if you got a shot in the fall, I think it was October, you're due for another one. If you have had COVID, you should wait at least 3 months from having COVID to getting vaccinated. So those are the rules as they are presented to me today. So that's it about COVID. Then I wanted to say, did you watch the women's Hawkeye basketball game when they stomped on LSU? Because I was screaming at my house. I've never seen so much excitement about women's basketball my whole life. So it's very exciting. Friday is the Final Four game, right? And they're playing UConn, who I think we can beat easily, but I don't want to curse anything. So fingers crossed that the ladies win in Cleveland on Friday and go to the championship game, which would be back-to-back years, right? So very exciting, lots of basketball talk. You know, if you know me, I'm not a sporty person, but this is pretty exciting and it's hard not to watch. So that's basketball. You'll be seeing some clips. 2 weeks ago, Cam and Lindsay and I were on KCRG to talk about the dementia simulation. And just yesterday, Cam and Bruce were on KCRG talking about dining with dignity. If you haven't read about that yet, we're offering dining for people living with dementia and their family members in a lower stimulus area with fewer choices on the menu and pictures on the menu and a quieter environment. And we're hoping to create a really special environment at Third on Third on Mondays. That program kicks off April 15th. So you can call Haley Bergen-Jackson, who I'm very familiar with, and she is coordinating the reservations for that event. You can also order food from Third on Third in mixers on Mondays. So we're not going to have the phone on downstairs so it's not noisy and distracting for people while they're dining with their family. So I'm really proud of the work we're doing to reach out into the community and provide dementia awareness and education, building a more inclusive community with just kindness and reducing stigma for those folks who are living with dementia. So I'm proud of Oakal as a community for pushing that forward. I'm very grateful to all of you who have gone through the simulation so far, and if you have families in mind who could benefit from that and the discussion afterwards, please talk to Cam about signing up to go through that. My final announcement is that Cam Atwater, our amazing volunteer coordinator, has accepted the position of the At Home with Oakal manager. So if you see her, please congratulate her. She is very excited, and because she's in a current position at Oakal, it'll take us a while to transition her. And so I'm going to continue staying in contact with the At Home team. I like very much being involved with them, and what a terrific service we provide to the Oakal residents and the community in Iowa City and Coralville. So great things happening at Oakal. I'm really hopeful that we'll get through this certificate of need process, and then we'll be able to expand the size of our health center. And Steve's on vacation. So, if you want to have any crazy ideas, this is the week to do it. Call me. We'll see what we can get worked out. I'll come back and see you in 2 weeks. Thank you and take care.